All right, so here we were talking about those dermatomes, right? That's the patch of skin that's innervated by a particular spinal nerve, right? C3, C4, T2, right? And then I also mentioned in the videos that you could recognize those, very visibly when you have shingles, right? That is when you get an infection, it's a viral infection, and the little virus hangs out in your dorsal root ganglia. And then when you're at your weakest, it becomes activated and kind of causes this infection in that very particular patch of skin, as you can see here, right? And it's obviously on the guy's right side dorsal root ganglia, somewhere around C2, C3, right? So cervical nerve number 2, cervical nerve number 3, right? Nerve 3. So, and then you could kind of correlate that with the dermatomes right here. So that's your spinal nerves, and that's kind of a visible manifestation of those dermatomes. So here's another particular dermatome right over here. And you can see that this one is on the left side of the face, right over here. It goes down, about down to the nose, covers around the eye right here. So a very specific pattern of infection that this person got with this, herpes virus right here, or certain types of roster virus, right? And you can see on this guy over here, half of his tongue, right? And then like half his chin area right here was also infected, right? So these viruses, wherever they were hanging out in a ganglia of the nerve that was innervating this patch of skin on the face and inside on the tongue, right? So here's this nasty little virus right here. It evaded your nerve. You got infected. It invaded, your immune system fought most of it off, but it kind of crawled in the safe space right here inside the ganglia right here and just lie dormant again until, your immune system was weakened for whatever reason, right? So viruses, you never know what's going to happen with them. That's why people are, very concerned what's going to happen with people with coronavirus, right? Because viruses, almost all like the autoimmune diseases you see, are probably caused by viruses. A lot of cancers are caused by viruses that we never knew about, right? They just do it and they cause some sort of weird thing. But in any case, in this one, it's hanging outside there, and then it travels, right? Once it becomes activated, it travels and it goes to wherever in particular that nerve was innervating, right? So in this case, for the facial skin right here, for that pattern right there, right? This one was innervated, right? Here's that C6, C5, C4, C3, right? So that's cervical vertebrae. But over here, you'll notice these are called V1, V2, V3, right? But they're not really V's, they're number 5s, right? Because this is a Roman numeral number 5, which is indicating the trigeminal nerve, cranial nerve number 5. And it has 3 divisions. You don't have to know them, but it splits off and innervates the patches of skin on your face, right? That's cranial nerve number 5. So that brings us into our cranial nerves, right? But you can see already, you want to learn what you know about spinal nerves. And, this is not super different, but there is some differences that we'll talk about here. And you have to know a lot more in detail about them. All right, so your cranial nerves, right, your spinal nerves rather, are coming off your spinal cord, innervating your body right here. And a little farther up, as the spinal cord enters the skull and becomes the brainstem, right, all the motor and sensory neurons are located within your brainstem and branch out. Their nerves, the cranial nerves, come out and innervate your face. Right, so cranial nerves, spinal nerves, right? They're nothing too mysterious. They're just the nerves that innervate your face and head, right? But it does have a couple specialties. And so here is your, from one of those 3D apps right here. Right, down here are your spinal nerves, right? Coming out of that intervertebral foramen of your vertebrae, right? They're going out to innervate your body, right? And those patches of skin and all your muscles and everything like that. And then once your spinal cord enters the brain, it becomes the brainstem. And then the nerves that are coming off that, instead of going through the intervertebral foramen, they're going through those holes, some of which you may or may not remember, right? So here is a superior view rather, with the brain removed. They've cleaned it out. This is the dura mater that you could see right here. And then you got all these nerves, right? Just kind of like the spinal nerves, right? But here is your, right down here is your spinal cord or the rest of your brainstem. All the nerves coming out. And once it enters the brain, you still have that same pattern of nerves coming out of it. This time, instead of the intervertebral foramen, they're going out through all those holes, right? Remember the optic canal up here, right? And then a foramen rotundum, right? With these nerves right over here. These are your oculomotor neurons. Over here, those trigeminals coming out over here, right here. Remember the internal acoustic meatus, right? These are your auditory nerves going through this little hole, right? So these are all holes, they're going out toward, the facial muscles, the facial skin, your eyeballs, all that stuff right here, right? These are the olfactory nerves. Right, so these are the cranial nerves, right? And so for these, unlike the spinal nerves where I just wanted a general sort of knowledge, right, about anterior, posterior, medial, lateral type of stuff at the most, right? Here we have to know a little bit more. You got to know the names. You got to know what they innervate, whether a nerve is just sensory or just motor, right? And a couple of other details, which you'll see in the learning objectives there. All right, but these nerves, again, this is without the skull. All these nerves coming off the brainstem and innervating these different parts of the body, right? And so today, I'm just going to kind of go over some of the more major ones and what they innervate, just to give you an idea, right? All right, so your task, if you choose to accept it, list and identify the cranial nerves by name and number, right? So cranial nerve number 1 is the olfactory nerve. Cranial nerve number 5 is the trigeminal nerve, right? And that trigeminal nerve has 2 major functions. Number 1, innervation of the skin on the face, and the innervation of the mastication muscles, right? So maybe this one has sensory and motor, so it's a mixed nerve, right? So that's what you'd have to do for each nerve, and you won't have to know, maybe one sentence about that function. And then there's also some cranial nerves, which will bring us into the whole autonomic nervous system discussion. These ones with the visceral component, which we didn't talk about at all with the spinal nerves. All right, so I'm going to go over again some interesting one, just to kind of have you maybe lump all these in, some small categories for easier remembering, right? So don't think it's so overwhelming, right? So remember, way back in the bone, we had that cribriform plate there in the ethmoid bone, and right above the nasal cavity right here, right? So this is an interesting one. This is the olfactory nerve, sometimes called the olfactory tract. And at the end right here, you have this olfactory bulb, and then you have these nerves dangling down into the nasal cavity right here, right? So this is a close-up. There's the cribriform plate. Over here, these nerves are kind of dangling down. Here are the odorant detectors right here, right? These are going to pick up little tiny bits of odorant molecules and tell you what you're smelling right here. Or they also have a lot of ACE2 receptors, so that when you breathe in coronavirus, they can enter those the olfactory epithelium up here and get into your body and infect these, right? But this is your olfactory nerve, cranial nerve number 1, right? And it just has, is there any muscles that you could think of in your nose? The answer is no. So this is just purely sensory nerve, right? It doesn't have any motor function to it, right? This is one of your special senses, and that's cranial nerve number 1. Here's another one that's purely sensory. That is, there is ear muscles, but none of these are innervating, right? This is cranial nerve number 8. I'm jumping to number 8 because it's another special sensory one with only sensory information, right? Cranial nerve number 8. Sometimes you'll see this referred to as the auditory nerve, or sometimes the vestibulocochlear nerve, because it has those vestibular, that is the sense of balance. It's innervating that organ that mediates the sense of balance, and your cochlea, which mediates your sense of hearing, right? So it comes out of the brainstem, enters that internal acoustic meatus, and goes inside that petrous portion to innervate those portions right there. So your auditory or vestibulocochlear is cranial nerve number 8, purely sensory. And then there's cranial nerve number 2. I'm jumping back to second one right here because it's another purely sensory one. And this is your optic nerve. Right, we kind of saw the optic chiasm when we were looking at the brain stem pictures right here. So your eyeballs are picking up information on the back. There's photoreceptors, the nerves pick it up and they bring it in to your brain. And again, they're going to cross over to the other side of the body right there, right? These are your optic nerves, right? Attached to the back of your eyeball, entering directly into your brain. Your optic nerve. You'll also see this referred to as the optic tract because technically it is all inside the brain and there's not really much of a nerve there, but don't worry about that. Cranial nerve, optic nerve. Cranial nerve number 2 is your optic nerve. And so here it is again. Here's your eyeball. Here's a side view of your eyeball. All your photoreceptors are on the back of the eye. Light comes in, strikes them, and well, it kind of deactivates them, but whatever. It stimulates. There's a signal coming in through this optic nerve, which is going to go to the back of your occipital lobe right there for interpretation. Right? So that's your optic nerve. So this is a nice cross section. You see all this fatty tissue, like kind of holding in your eyeball right here. But then you also see all these muscles, which we didn't go over. Over here, we didn't go over these. But these muscles are what make your eyeballs move up and down and sideways and obliquely right here, right? These muscles right here. These are voluntarily controlled, right? So most of that is done by your oculomotor nerve. That's cranial nerve number 3, right? So the first 3 we just talked about, cranial nerve 1, 2, and 8, were sensory because they had those special sensory nerves. So here is one that is a motor nerve, right? All it is, it comes out and it innervates a bunch of these muscles that are controlling the eye, right? So the oculomotor, the trochlea, and the abducens, cranial nerve 3, 4, and 6, are all controlling these eye muscles. And you don't have to know which eye muscle. You just have to know they're controlling the eye muscles. So you could lump these in together. Cranial nerve 3, 4, and 6 as muscles that move the eye. And these are purely motor ones. They don't have a sensory component to them. Right? So your eyeball sense information was taken in by cranial nerve number 2, and then to move these eyeballs around, they're going to be controlled voluntarily by oculomotor number 3, trochlear nerve, cranial nerve number 4, and abducens nerve, cranial nerve number 6. All right, so oculomotor, trochlea, these are all controlling the eyeballs. So far, so good. You're going to lump these in together. So if I ask you, what does the trochlea do? I'm not going to ask you it's innervating the trochlea muscle or anything like that. You just got to know eye muscle. And so extraocular eye muscles. These will be distinct from some of these smooth muscle things, which we'll talk about later, right? Because oculomotor nerve, just purely motor, but it also is doing some smooth muscle stuff, which we'll get into when we talk about the parasympathetic pathway. It's good so far. All right. Then, right, so those are your eye muscles. What about the rest of your facial muscles, right? All the things like orbiculus oculi, your zygomatic major, right? Your depressor angula oris, all these facial muscles that are making your facial expressions are controlled by the facial nerve, right? Facial nerve, cranial nerve number 7, right? Cranial nerve number 7, when we talk about its function, its motor function, that's what it's doing. Because as we'll see, there's also a sensory division of the facial nerve. All right, we all good so far? Right? Eye muscles are those cranial nerve 3, 4, and 6, whereas the rest of the facial muscles up here are done by your facial nerve, the motor division of your facial nerve, right? Facial nerve, facial muscles. The other muscles on your face, remember, we kind of divided them into the facial muscles that were making all those expression and your muscles of mastication, right? Those are your masseter, your temporalis, maybe some of your pterygoids, your buccinator, I think, right? These are controlled by another nerve, your trigeminal, right? We saw the trigeminal, and we'll get back to its sensory function, but this is its motor function. Right. So that almost takes care of all the muscles. I can't think of any more. Actually, there's some tongue stuff down there, but your eye muscles, cranial nerves 3, 4, and 6, your facial muscles, cranial nerve 7, and now your trigeminal are doing that muscles of mastication. So my advice is to try to lump those in together to kind of clear that whole facial, that whole muscles in the head kind of thing. All right. So that's your trigeminal, and that's its motor function. That is the motor neurons that are coming from the trigeminal nerve, right? But both the 7 and 5 are also going to have sensory division. So just put a pin in that for a second. Oh, you don't have to. Here it is. So here's that same trigeminal nerve, right? That innervated the motor division, did those mastication muscles. It has a sensory division, right? Those are coming out and doing like we saw with those shingles back over there, right? That gave that dermatomes right over here. So your trigeminal nerve has both motor and sensory functions. And by the way, I'm going to give you a nice mnemonic to remember motor, sensory, and all that. So don't get too bogged down in this. I'm just trying to give you some nice examples, right? Remember that half a tongue that the guy had infected right here? So part of it is going down here. And I'm not going to ask you about the different divisions of the trigeminal nerve, right? Just cranial nerve number 5. Sensory division does that innervation of the skin on the face, right? And some of the tongue too. All right. So that's your trigeminal cranial nerve number 5. It's the biggest one that you can see very clearly, right? Here's another. So those are all those muscles of your face, right? And the muscles of all your face and mastication, as well as the innervation of your skin on your face, as well as your sight, as well as your hearing, as well as your sense of smell, right? Those basically all that head stuff. The next really important nerve, right, that I want to mention here is cranial nerve number 10. Cranial number 10, this is the vagus nerve, right? This one is coming down. Instead of going to the face, it does have some facial innervation, but it's most famous for dropping down into the thoracic and abdominal cavity to innervate your viscera right there, right? So this, when we talk about the sympathetic and parasympathetic nerve division, the parasympathetic, like 90% of our parasympathetic is done by this vagus nerve. And this is cranial nerve number 10. It's a cranial nerve because it starts way up in the cranium up there, right? So this is vagus nerve, cranial nerve number 10. All right, so that's another important one here. Those are the only ones I'm really just going to go over just because they're some of the major ones right here. But what I want to go over right now is to go over how you're going to remember all that, right? Not everything, but the easy ways to remember stuff for the cranial nerves. And this one, I'd say, even if I asked one question on the exam, you should really try to get these kind of things down because this will follow you throughout your rest of your healthcare, education. Because somebody figured it all out and they want to test you on it, right? But these are the 12 cranial nerves, right? The olfactory, the optic nerve, the oculomotor, the trochlea, right? The trigeminal, the abducens, the facial, the acoustic or vestibular, right? The glossopharyngeal, the vagus, the spinal or the accessory, and the hypoglossal nerve, right? And so if you ask me what number the glossopharyngeal nerve was, you'd see me kind of mouth some things and count on my fingers, because you're going to remember these O, 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 T, T, A, F, A, G, V, S, H by remembering some mnemonic, right? That you're going to look up on the internet and find a one that you like, right? My one that I learned in graduate school is a clean one, and it's on old Olympus's towering tops, a Finn and German viewed some hops, right? And so there's all sorts of dirty ones out there. So you could find out whatever one helps you remember it the best, right? Just look up cranial nerve mnemonics on the internet. You'll find a whole bunch, right? But there they are. That's what you want to do for learning at least the first letter of those cranial nerves, right? O, 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 T, T, A, F, right? And then you'll hopefully remember, at least you'll have some information about those, right? And then the other mnemonic right here is this other one that says, some say marry money, but my brother says, I can't see it, big brains matter more, right? And this means, what these mean is, remember those cranial nerve number 1, 2, and 8 with those special sensory? These are just purely sensory nerves right here, purely sensory. So some say, says is all sensory. And then marry, money, my, matter more are purely motor nerves, right? They don't have a sensory division. Whereas the B's, right, your trigeminal, as we mentioned, has the innervation of the face, the skin, as well as the mastication muscles. That's a big one for both motor and sensory. Your cranial nerve number 5 also has both. Your cranial nerve number 10 does, right? So on your facial nerve, as we mentioned, just all these have both sensory and motor divisions. All these B's, both. That's what that stands for. All right, so that's how you're going to remember that right off the bat, right? Which one has motor, which ones have sensory. Everybody kind of get at least the general idea of what this means right here, right? All right, and then the last little thing that you'll notice here is that some of these have little asterisks right here. The cranial nerve number 3, 7, 9, 10. That's how I remember, 3, 7, 9, 10. I just say that over and over again, 3, 7, 9, 10, 3, 7, 9, 10, right? These are ones that have a visceral component. That is, these guys, you know, over here, like the trochlea nerve and the abducens nerve are just innervating skeletal muscles. That is, they're part of the somatic pathway. These ones, 3, 7, 9, 10, all have a visceral component. That is, they're innervating either smooth muscle, like in the case here, your oculomotor neuron is controlling your pupil dilation, for instance, or actually constriction, in this case, your oculomotor. Your facial nerve is innervating some of your lacrimal glands in your eyeball, right? Your glossopharyngeal is doing some of your salivary glands. And of course, your vagus nerve is one of your main visceral components right there. So these all have, as opposed to skeletal muscle innervation, these also have visceral motor. So they're part of the parasympathetic pathway, as we'll see. And so only 4 got visceral is how I do it. Oculomotor, facial, glossopharyngeal, and vagus. All right, so those are just stupid ways to remember what's what. And then for the details of what you got to know is pretty much on this slide right here. This slide, this very slide, sensory, you know, sense of smell or nose, right? Sensory, eye. What's your eye vision, right? So all these, that's the extent. And again, even this, the oculomotor, trochlea, and abducens, you don't have to know the precise muscle. That these are all just eye muscles right there. And the rest of them, sensory, face, basically, that's good enough. These muscles of mastication. All right, so that's basically all, you know, the extent that you want to actually know the details of what they innervate. All right, so you're going to learn those mnemonics, and then maybe draw a picture like this to kind of help you memorize what they actually done, right? All right, here's another stupid way to remember it. Cranial nerves, right? This picture right here. Let's see if I can help. Anybody understand what this picture is? This is a face over here, and what the numbers imply is kind of the rough area what these nerves are doing, right? So here's your cranial nerve number 1, right? That's your, olfactory nerve. Number 2 over here is your optic nerve, right? So that's because it's making an eyeball right here. And then you have those other muscles controlling your eye, right? Your oculomotor over here is around the eye. Your trochlea nerve, that's another eyeball one. And then your abducens nerve for number 6. So notice they're all around the eye. How clever, right? 1, 2, 3, 4, 5, 6. And then your ears, your face is number 7, right over here, making up your face. So this is kind of making up the whole face. Those are your facial muscles. And number 8, obviously, is your ears, making up your ears. And this is, again, remember the auditory or vestibulocochlear, whatever you want to call it. And I forgot number 5 here, the big one. See how the big 5 right here is making up a bunch of stuff, your whole face, and your, those mastication muscles, right? Your trigeminal right there. 6, 7, 8, 9, and 9 is your, let's see, on old Olympuses, towering tops, aphen in German, glossopharyngeal over here, right? Making up glosso, meaning tongue, pharyngeal, meaning your pharyngeal muscles that are for your throat right there. So number 9, sorry, I didn't use the right colors. Number 9 is your glossopharyngeal. Number 10 is going down over here. That's your vagus nerve. Remember, that's your one that's going down all your viscera of your guts. Vagus. Number 11 is your spinal accessory. These are basically your traps, like some of your muscles over here. So it's called your accessory or spinal accessory. It's really a kind of glorified spinal nerve right here, right? Number 11, or your spinal accessory. And then number 12 is your hypoglossal, underneath your tongue right here, hypoglossal, one of those motor movements helping your tongue move right there. And so number 12 is your hypoglossal. All right, so that's another clever sort of dumb thing that you can use to memorize all those cranial nerves. And again, use these tricks good because they actually do persist. Right? Even if you never have to know where your ulnar bone is, at some point you will have to know these cranial nerves. So the last thing I want to do is go over the inferior section in terms of the cranial nerves. Right? The cranial nerves right here. We already saw a few of these when we looked at this inferior view. Right? So that first structure, the cranial nerve 1, right, are the olfactory bulbs. So this is cranial nerve number 1. And then right below that is cranial nerve number 2. Right? After this, it becomes the optic tract, technically. Right? So up here is the cut, this where the cranial nerve number 2, the optic nerve, has been cut. So that's 2. And then the next one is number 3. Right? Well, it's not so easy, but coming right off the pons right here. And over here, you could see these coming off here. This is the oculomotor nerve, right? Going to your eyeballs, controlling your eye muscles. This oculomotor cranial nerve number 3. 1, 2, 3. And then the next one down over here is another one controlling your eyeball muscles. Coming from behind there, actually, in this picture, it's right over here, is your cranial nerve number 4, your trochlea nerve. The trochlea nerve over here, coming from behind the pons, right? Coming right off the pons right here, the major one is your trigeminal. That's cranial nerve number 5. And in this picture, there's a couple of branches over here, right? That's the trigeminal or cranial nerve number 5. So 1, 2, 3, 4, 5, and then 6. Again, you want to find your landmark right here. In case you miss one by accident, you want to start again. This is cranial nerve number 6. This is your, I'm going to start with the red again, is your abducens, another eyeball moving thing, right? So cranial number 3, 4, and 6 are all moving your eyeball muscles. Whereas cranial nerve number 5 is innervating your face, the skin on your face, as well as innervate the motor component has the muscles of mastication. Right, so here is the abducens, right, coming right off the pons right there. Abducens. All right, so after number 6, in this picture, we'll just call this one here, there looks like there's 3, but over here it's difficult to tell. The first top ones at least are the cranial nerve number 7, the facial nerves, right? So the facial nerves, remember, are the ones that do all your facial muscles, right? Control all your facial expression muscles. Oh, that's cranial nerve number 6. Right under that, it's not clear on this picture. Oops. All right, here's cranial nerve number 7, facial nerve. And so 5, 6, 7. Then right under number 7. Here, it looks like there's 2, but these are 2 structures coming, two nerves of the same name over here, and it's not really clear. So you see the most anterior one or superior one, that's going to be number 7, and then the one below it down over here will be cranial nerve number 8. And this will go through your, let's put this over here. This will go through your internal acoustic meatus to innervate your inner ear. Right? So that's cranial nerve number 8, your audio nerve or your vestibulocochlear nerve. So 6, 7, 8. And then the next one below it is the green again. And the next one below it, right over here, is number 9. This is your glossopharyngeal nerve, a motor nerve that's innervating your underneath around your tongue and your pharyngeal, right? As well as has some visceral functions. So that's number 9. And then number 10, below it, make that black, is your vagus nerve, your vagus nerve. And that would be just this one over here. Remember, this will go all the way down to innervate. This is your major parasympathetic output nerve, right? That's going down to innervate all the viscera down below, right? So 9, 10, and then 11, yellow, is actually your spinal nerves, right, coming off. Part of it actually is in the spinal cord. This is innervating, among other things, your trapezius muscle, right? So that would be these coming off here. So that's your spinal nerve or spinal accessory or accessory nerve. And then the last one here is, we'll make this red, coming off the middle right here. This is your hypoglossal. And you can only see one of them in this picture, but there would be another one coming off here, right? They probably have delicate nerves that have been torn off. All right, so that would be number 12 right there, your hypoglossal nerve. All right, so those are your cranial nerves. And again, you want to find, first your landmarks. You can go down 1. I never made the red ones there. 2, 3, coming off the top of the pons right there. 4, coming from behind the pons. Cranial nerve number 5, the trigeminal, this very large one coming off the pons. And then your abducens, cranial nerve number 6, is coming off the top of the medulla oblongata, kind of covering the pons right there. Again, that's another eye muscle one. And then your 7, cranial nerve number 7, facial, cranial nerve number 8, audioacoustic or vestibulocochlear. And then cranial nerve number 9, glossopharyngeal, cranial number 10, your vagus nerve, 11, your spinal accessory nerve, and then 12, your hypoglossal nerve. All right, so those are your cranial nerves that you'll want to know there. All right, and that's it. We will see you next time. All right, see you later.